What's up, everybody? Happy Monday. Welcome to another episode of Learn with Flo. If you have been here before, welcome back. If you are new here, buckle up for the ride because it's going to be a fun one today. We're going to be really taking another layer deep into our conversations around root cause medicine, right? So again, if you're a newcomer or you're been around my lowdown methodology and platform before, you know that I love really digging into the science behind what makes our bodies work, how to work in alignment with our actual physiology versus fighting against it. And I think the more and more that we'll start to see this movement towards a new paradigm in medicine, right? Having people feel seen and having people feel heard, having people feel validated in what they're experiencing, and also getting the help that they need, whether that's from their normal family practitioner, more holistic practitioners, really just a healthcare team surrounding these individuals and lifting them up to really find their maximum health potential, right? So if you were with us last week, we really got to talk about the main pillars of what root cause medicine actually is. And that drummed up a whole nother aspect and layer to these questions of how do we identify or how do we discern as patients out there, and even as providers out there, how do we discern that what we're teaching, what we're practicing, what we're implementing is really part of more of a root cause treatment and a root cause look at our health and healing? Or are we kind of getting duped by another Band-Aid treatment or another spot treatment strategy, right? And trust, high level disclaimer, as I even get into all of this content, we'll wrap that up at the end today too. But I really want to start off by saying that doesn't make any spot treatment or Band-Aid treatments bad, right? I think a lot of times we get into this world and we get very polarized, and we kind of take these two extremes, right? And it's like, oh, if we know that it's a Band-Aid solution or a spot treatment solution, then it's bad or it's demonized or it's looked down upon or frowned upon. And that's not necessarily true. I think both can be true. I think my biggest passion point becomes when individuals are not fully educated or fully informed about what the difference is between a root cause strategy and more of a Band-Aid treatment, right? And so they feel like they're getting something that's going to really be this magic panacea, right? Or this magic pill. And they usually end up pretty disappointed because they're kind of like sold a promise and a prayer of something in the healthcare and wellness space that really doesn't end up panning out that way, right? So let's just kind of, like I said, take a little bit of a reframe to this and go next layer deep so that you guys as patients and, like I said, even practitioners out there can build the practice that you want to practice around true root cause healthcare, or you as a patient can actually seek out that true root cause healthcare approach as well too, and not continue to accidentally get duped by some of these more what I might call like greenwashed medicine practices out there that are claiming something that they can't really hold up their end of the bargain, right? So let's just start high level and kind of review a little bit around what is root cause medicine, what defines root cause medicine. I like to just boil it down to some of the main pillars that I have built my lowdown methodology around and what I teach other practitioners and what I teach my patients to also kind of embody and believe about what we know about the human body in general as well too. So number one, root cause medicine is built on this belief and principle that the body has an inherent wisdom to really heal itself, especially when we treat the whole person. We take into account that we are a physical body, a mental body, an energetic body, a spiritual body, right? So we're not just treating the physical body, we're treating all of those aspects because they all interact and interplay together. Second, root cause medicine is defined by the belief and the principle that healing looks beyond symptoms and we really look for the source of the dysfunction. And we'll dive into that even deeper today. And finally, root cause medicine to me and at the lowdown methodology is that there is a patient-provider relationship that is founded on education, inspiration, and empowerment to really help you take ownership of your healing, right? It's not one of those situations where oh, the doctor's in the driver's seat and they're just telling you what to do. It's more like, oh man, this is a two-way relationship here, right? They're educating me. I'm feeling like I'm part of the conversation. I feel like I'm educated in the pros and the cons of different directions that we could go. And I get to be an active participant in really choosing what direction we go, but also being an active participant in getting my needs and my wishes validated for in that as well. So again, I think we're really seeing, I know I'm really seeing this, and I think a lot of other individuals are feeling this too, that there is this growing surge of interest in more of this, call it root cause medicine approach, of really asking not just what am I experiencing, but why am I experiencing it, right? That really is the big question that I seek to answer, and helping my patients, like I said, come along for that ride and feel like an empowered part of that experience when we start to treat the body as a whole. So there's a growing surge of other individuals, other practitioners and providers that are starting to see this and want more of that. And also a lot more patients out there that are expressing interest in taking their health more this direction. And not only just an interest, but honestly, a downright need and a downright demand, because there's so many people that are falling through the cracks of what more of a conventional medicine system can offer them, right? They feel like they don't fit in the box. And if you don't fit in the box, then you kind of get left high and dry, right? You get left feeling like you weren't heard, you get left feeling invalidated, you get left feeling like a hypochondriac. I literally got off a call today, just an hour before this, where she's like, wow, everything that you're describing to me and the why I'm feeling it, like I feel so validated, because I can't tell you how many years I went in and out of different doctors' offices and practitioners' offices, and they made me feel crazy. And they made me feel like a hypochondriac was the word that she used. And she's like, I knew something wasn't right. She's like, but I couldn't place it. And they kind of make you feel like everything's all in your head, right? So as we're seeing a greater need and a greater demand, because like I said last week, our health issues aren't necessarily getting more simple, they're getting way more complex. So especially if you're signing up to be more of a practitioner in this field, like we have the unique challenge and blessing to be able to take on some more of the complex health conditions. And so because of that, though, I think we're going to also start to see maybe some practitioners and providers that may claim to kind of be part of this movement, but they actually don't embody more of that like root cause healthcare approach. And they might just be kind of selling people Band-Aid solutions in disguise, right? So that's where today I want to go that next layer deep and really start to talk about what, as a discerning and educated patient out there sifting through this field, I want you to feel really excited about this type of medicine, like finally getting more mainstream, while not getting confused or overwhelmed or feeling victimized by someone or something out there claiming to be this like magic panacea, and be able to really understand like when maybe it's not that, right? So how do we identify the difference between kind of a spot treatment solution versus true root cause medicine? I want to talk through that today, and I think the best way to do that is by coming to the table and giving you guys 3 main questions that you can run your own filter through. These questions can be used to kind of any strategy, any pharmaceutical, any supplement, any diet, any protocol that's kind of out there, right? That you're like, oh man, this really could help me. It's like you can run it through these 3 questions pillars. And also these 3 questions can and should absolutely be questions that you bring to your healthcare provider as you guys discuss and have conversations around what route is best for you, right? So I'm going to help answer that today with just some key questions that you can use to help filter out some of the dupes out there from really the true root cause medicine, as well as share some relevant examples with you guys. So let's just get right into it. So filter, I'll call them like a filter question. When I say a filter question, I like to coach a lot of my patients on using questions like as a filter to kind of answer it for ourselves, right? And it's like, is that true? Is that ultimately true? Like what am I kind of seeing when I use my own rationale and logic behind this? So filter question number 1 is, as you're kind of looking at different treatment strategies out there, again, this falls under diets, protocols, pills, powders, medication, supplements, all of that stuff. First filter question that I would ask your provider is this something that only works while I'm taking it? Pause there and kind of let you kind of sink that in. We are conditioned and really taught from a very young age to think that, if you don't feel well or you're sick, like you go to your healthcare provider who gives you a pill or a prescription or sometimes even a supplement, and off you go with like really no other instructions except for continue to take this for the rest of your life and somehow now you're healed, right? That's really kind of where more of our traditional or conventional medicine has kind of learned us to go. But when you try to go off of that supplement or medication, all the same symptoms come back, and sometimes all the same symptoms come back like tenfold. So you're not really healing anything. And I think one of the biggest bold statements that I'll make is you're just masking symptoms with those things, yet the disease progression that your body was trying to get your attention for with the original symptom, that disease progression is still taking course, right? So even though we might have symptoms that feel a little bit better, the bigger picture of the disease progression that was manifesting behind the scenes as part of that symptom, because symptoms are always our body's way of trying to get our attention, right? And so the hard part is we kind of shut that symptom up, but the symptom was trying to tell us that something bigger is kind of brewing behind the scenes, right? So that disease progression is still persisting. So to me, this is kind of by far and away the most common misunderstanding of pharmaceuticals or even nutraceutical supplements as well too, is that we kind of start them and somewhat take them forever, or that they are somehow healing something behind the scenes when we know that there's no pharmaceutical that has the capacity to do that, right? It's helpful for symptom management, but like I said, once you try to stop it, all of the symptoms come back tenfold, so you didn't really heal anything, right? So I even heard this. I thought this was so crazy. I heard this on a recent radio advertisement, who listens to the radio anymore, but it was on in my car. It was for a CVS pharmacy commercial. And they stated in this radio ad, they're research shows that those who take prescription medications are healthier, right? And I was like, wait, what? It was their statement to try to get people to make sure you're refilling your prescriptions and staying on top of them. And I was like, wait, we've gotten this all backwards. If that's our understanding that you stay on top of your medications, you take them consistently and you don't skip a dose, or you're never off of them or descripted from those medications, you're somehow healthier. And I'm like, wait, I'm sorry, what? Right? The whole point is that we don't need those things to begin with. That's health. That's healthier. Not the more medications you take and the more consistent you are with them, ship shape, right? So what are some real life examples of this? I think one that I had a recent conversation around with a gal was blood pressure medications, right? Great example. They work while you're taking them to temporarily lower blood pressure in scenarios where that's absolutely necessary, right? High blood pressure is not good for health. We can't have that uncontrolled. But that blood pressure medication is doing absolutely nothing to address the insulin resistance that's causing the vasoconstriction behind the scenes, and then all of the subsequent chronic disease that's still brewing, right? So it doesn't mean that, just because I lower my blood pressure, it doesn't mean that I'm not still on the road to full-blown hyperlipidemia or metabolic syndrome. I'm like, no, you very much are. The blood pressure was just your body's first way of trying to get your attention to make some root cause changes. So that would be one of those where those are still building and brewing behind the scenes, even with the blood pressure medication on board. Or similar patterns we see with cholesterol lowering medications or statins or blood sugar controlling medications like metformin. It's those things are there and they're very helpful to reduce the symptom that our body was trying to get our attention for, but they don't necessarily do anything to stop or pause or halt or slow the ultimate disease progression that's happening behind the scenes. That's what our root cause fixes come in for, right? You also see this happen in more of the functional wellness space too. So it's not just pharmaceuticals. Like you can see this with like digestive enzyme supplements. That's a perfect example. You see digestive enzymes everywhere, like reduce your bloat, all of that. Do I recommend digestive enzyme supplements on a consistent basis to individuals? I sure do, but they work while you're taking them. They're not a long-term solution. They're a bridge strategy to say like, hey, here's something that's going to temporarily help reduce some of the symptoms while we work on the root cause solution behind the scenes. Because ultimately the goal is that you don't have to take digestive enzymes and you still don't feel bloated, right? It's like, then we got to the root cause issue. Not that we put a digestive enzyme supplement on it and you take it forever. It's like, no, it's going to lose its potency. It's not going to work eventually at some point in time. So it's, like I said, the digestive enzyme supplement is not fixing the root cause of their low stomach acid situation, right? Or the other downstream ramifications that are happening because they have low stomach acid. Or I think we see the same thing in the functional space with like hormone replacement therapy and definitely birth control therapy, right? It's like, gonna ruffle some feathers with this one like I always do, but these things work while you're taking them, right? To temporarily reduce things like hot flashes, or they just magically make your period problems go away, right? But they do nothing to address like the underlying gut dysfunction or liver dysfunction or any of those things that are still brewing behind the scenes, right? I see this very commonly with even like an endometriosis picture. It's like sometimes we need to bring in birth control to like stop the bleeding, give that woman her quality of life back, but then like the endometriosis, like that is an immune system dysfunction. That's a liver detoxification issue. There's probably some genetic variants going on there. Like that's still brewing behind the scenes. Like what are we doing to address that? Like while she's on birth control, right? It's like, or what are we going to do when she wants to become pregnant later in life and has to come off the birth control? Like, hey, endometriosis is still there, like surprise, right? So that's, like I said, the filter question number one is this something that only works while I'm taking it? If the answer is yes, then we know it's more part of like a Band-Aid or a spot treatment strategy, right? Doesn't mean it's bad, just means like, hey, so that you're discerning, you know where it belongs, that's where it belongs. It's not part of a root cause plan. Filter question number two to kind of run through here. Is this something that has an exit strategy? Very similar to question number one, where we asked like, is this something that only works while I'm taking it? Very closely related to it, filter question number two, is this something that has an exit strategy? So what is the exit strategy? At some point, do you get to at what point do you get to experience those main pillars of root cause medicine where we understand that the body has an innate healing capacity to it, right? Or do we just, like I said, continuously take these things seemingly forever? It's like, where's the exit strategy where my body actually picks up that slack, where my body actually self-corrects why I had some of those issues in the first place. So very, very often I do see individuals come to me with like a laundry list of medications, a laundry list of supplements. And like, I'm not kidding when I say like 10 or more prescriptions or like 10 or more supplements that they've been taking for years. And the worst part, when I prompt them about like, oh, where did you get started with this one? Who recommended this one to you? Why are you taking it? They don't even know. Right? They're like, oh, I don't really remember why I take that, or I don't really know what that one's for. Or, you know, it's like that to me is kind of like a red flag, right? You should definitely understand like, why are you taking something, whether it's a prescription, whether it's a supplement, and it's like, what is the reason and the season for that? And what is the exit strategy that we're building towards to get you off of some of those things, right? So a common example of this in the pharmaceutical space, proton pump inhibitors, like any of your PPIs, any of your acid blocking medications. If you really go back to the research, these medications were only approved for use up to 2 weeks. 2 weeks. And we see people on these things for decades at a time, these acid blocking medications. And I mean, I've seen hundreds of individuals like this, right? And nobody told them. They're like, no one told me I was really only supposed to use it temporarily while I made some of the diet, lifestyle, stress management adjustments to understand why my body isn't adequately producing stomach acid, right? So we know that the long-term ramifications, like we knew this. That's why we recommended, hey, let's not use this longer than 2 weeks, because we know that long-term use of PPIs contributes to nutrient deficiencies, mood disorders, right? Gut health, mental health, right? GI distress. Yet our modern medicine is prescribing these things like indefinitely and then just sending people on their way. When what they really need is like, let's do a full stool workup for things like hypochlorhydria, H. pylori, B vitamin deficiencies, stress, right? Like those are the things that are like root cause up in here, right? Or sometimes you can even encounter these like outside of pharmaceuticals. And I even see some of these things when it comes to not having an exit strategy, when it comes to certain diets, right? So functional, alternative, holistic practitioners are notoriously the worst at this, the worst. They'll bring people in and with good intention, they just don't understand like you can't stay on these things forever. That's not the point. That they'll put someone on some therapeutic diets like an AIP diet, which is autoimmune paleo diet, or a low FODMAP diet, or a low histamine diet, and just send them on their way. It's like, oh man, high FODMAP foods are bothering you. Yeah, you probably have IBS, which is really SIBO, like small intestinal bacterial overgrowth, 90% of the time. And they're like, here, low FODMAP diet. I'm just going to send you with a little pamphlet of foods to eat and foods to avoid and send them on their way. And it's like, a low FODMAP diet has never, not once, like cured somebody's IBS. It may lessen their symptoms for some time, but I'm like, what are we doing, right? Because you can't be on a low FODMAP diet forever. It's incredibly low fiber, which is so counterintuitive to optimal gut health, right? So all you did was just remove high fiber foods. It's like the question is like, why can't I tolerate high fiber foods? Right? That's the real question. So what they really need in these scenarios isn't, like I said, these therapeutic restrictive diets. It's like, what's that functional gut workup look like? We need to understand why they can't tolerate perfectly healthful foods. Because my definition of health is that you feel good not being restrictive of foods, right? You should be able to tolerate whatever foods you want to tolerate, especially like perfectly healthful foods, right? Of course, you're like, I feel awful if I shove my face with a bag of Doritos and Coca-Cola. I'm like, well, yeah, we all do, right? Like that's not an optimal diet. But I'm talking about when people are out there like, I need to eliminate like eggs, and I need to eliminate lectins, and I need to eliminate nightshades, and I need to eliminate apples because they're high FODMAP. And I'm like, what are we doing? I'm like, those are like perfectly healthful foods. Like our body should be able to tolerate that. And just putting someone on like a prescribed diet and sending them on their way, like that's a Band-Aid, right? Because what's the exit strategy to get them tolerating those foods, right? So filter question number 1, asking your provider around questions like, is this something that only works while I'm taking it? And then a very good filter question follow-up to that is, okay, then what's the exit strategy involved with this? Insert anything into that blank space. What's the exit strategy of this medication? What's the exit strategy of this supplementation? What's the exit strategy of this diet or this protocol, right? If they can't give you what the exit strategy looks like, chances are they just only understand it as like a Band-Aid fix and a spot treatment fix. And you may feel great for like 1 week, 2 week, 3 months on it, but then those symptoms are still going to rear their ugly head because we didn't do anything behind the scenes from a root cause perspective for it, right? So then closely related to both of those, filter question number 3 here brings us to our final question you can kind of prompt your providers with is this something that corrects one issue but creates 1 or 2 new issues, right? AKA, what are the side effects of said intervention, right? So you can enter in like, what are the side effects of this pharmaceutical? What are the side effects of this supplement? What are the side effects of this elimination diet, right? Anything in there is like, are we like, oh, look, your hot flashes got better, but now you have, chin hair, back knee, and you gained 5 pounds, right? And it's like, cool. Like I came in for hot flashes and now I gained like 3 new symptoms. Like my hot flashes feel better, but now I have 3 new ones. That's what I mean about, is it correct one issue and then create new issues that you didn't have before. So that's, like I said, a very discerning factor between something that's like a spot treatment Band-Aid versus something that's truly more of a root cause. Because to me, if it's more root cause, everything should like domino effect on itself, not create new problems, but it should be like, oh, wow, this not only made it feel better on my hot flashes, but I also didn't realize how bloated I was or how bad I slept at night, or I didn't realize how much sugar cravings I had at night. Like all of those got better too. And I'm like, oh, interesting. Like when there's a positive domino effect, now you know you're more on a root cause trajectory versus more of the spot treatment. So, and like I said, this can go for prescriptions, supplements, diets, some common examples. Maybe a woman starts testosterone replacement therapy, and it was sold to her it's going to help her lose weight, get her libido back, and resolve her joint pain. Great, awesome. That sounds fantastic, right? Well, maybe 30 days later, her libido is much better, but now she has acne, her hair's falling out, and she's gained 5 pounds. It's like, ooh, like not really the intended result here. It's like we have new symptoms and like really wasn't like the magic panacea maybe by itself that we were sold. Or I also see this with like even some of like the weight loss peptides and weight loss medications, right? It's like, oh, this is going to help me lose weight. Like I've seen plenty of individuals where they're like, I'm down 20 pounds, but like now I have bloating. Now I'm chronically constipated. I'm sensitive to 15 new foods and I have acne. I'm like, did you have any of those problems before starting this? And they're like, no. They're like, but I'm down 20 pounds. I'm like, cool, awesome. But obviously the 20 pounds really was just your body's as a symptom of something bigger behind the scenes, right? So it didn't necessarily make us any healthier by losing those 20 pounds. It really just made us like more aware of some of the things behind the scenes. I guess another example would be, say someone starts, like I said, that low FODMAP diet for chronic bloating or IBS-D, right? And 30 days later, she's like, wow, my bloating is so much better as long as I don't cheat. As long as I stick to exactly this meal plan and don't cheat at all, my bloating is so much better, except now I don't have diarrhea, now I'm constipated, and now I'm too anxious to eat outside the home, and I've also turned down all invites of eating with friends. And they're like, oh, were you nervous about that before? And they're like, no. I'm like, interesting. Like, now we created 3 new problems that we didn't have before. Like, great, your bloating's better, but only if you're like sticking to this very low fiber diet. Like, what's the plan to eventually get you comfortable eating in all food scenarios and also tolerating a high diversity of foods, right? So when it comes to, like I said, more of this root cause medicine shift and movement, I am here for it. I love it. But I also want patients to feel very empowered and educated and discerning to be able to go into their healthcare team and their healthcare provider and ensure that their provider is also thinking the same way, right? So the 3 filter questions that you can confidently go in with, and whatever kind of like treatment protocol strategy, whatever direction we want to go, you should be able to have a dialogue around, is this a treatment that only works while I'm taking it? And number 2, is this a treatment that has an exit strategy designed for it? And number 3, is this a treatment strategy that corrects one issue but creates 2 or 3 more? Right? That's where we really start to make that clear delineation between like what is a spot treatment and a Band-Aid strategy versus what is more of a root cause progression and a root cause strategy. So hopefully those 3 questions, you can, like I said, take them, write them down, put them in your notes in your phone app so that way you have them. And I think that those 3 questions will not only for you help you have a more confident filter as you're navigating the world of root cause medicine, even on like social media, and you're seeing all of these like pretty like protocols and diets and trendy supplements and all of this stuff. You can run it through those 3 filter questions for yourself, but then also taking those 3 filter questions to any of your healthcare providers, you're going to have so much more like productive dialogue with that provider that kind of, like I said, makes you feel like you're one and part of that overall treatment plan and treatment strategy. So I'm excited to hear if you guys have, like I said, any examples of this to share for yourself. Please drop them into the comments. I think that'll be a really helpful conversation starter for us. But then otherwise, I'm really excited to hear how you guys take these questions and are able to feel more confident in any healthcare arena, really looking for and weeding out for those root cause medicine strategies. So if this is something that you as a patient are interested in and learning more about, kind of feeling feeling your way through that process, you would be a great candidate for my functional wellness consult, where we're going to be able to come in together and you'll really feel what that experience feels like to have those kind of root cause conversations, to ask those types of questions in an initial consult setting, and really be able to hear what that domino effect plan for you actually looks like. So you can click the link in my bio if you're interested in that. Sign up for my functional wellness consult and we'll get you rock and rolling today. But otherwise, hope you guys have an awesome week. And like I said, drop in the comments anything that you